Hello, everybody. We are back, and this time I'm joined by Dr. Devon Kennedy. Devon, thank you for joining us tonight.
Thank you. Thanks for having me this afternoon and evening for those on the East Coast.
Yeah, definitely. So, Devon, I'm super excited for your talk here because I think that co-management is one of those topics that can be really an incredibly powerful tool for building a practice or adding it to an existing practice. But at the same time, I think it could be challenging to get started with co-management from, a workflow standpoint, a confidence standpoint, or even just understanding where to get started. So I know you prepared a presentation, so I'm going to turn it over to you and I will rejoin you when you are finished for the Q&A. So for those watching, leave questions in the chat and I'll do my best to keep an eye out for them. And once Devon wraps up, we'll go into the Q&A and I can relay those questions over. So without further ado, Devon, take it over.
Awesome. Thank you. All right. So as Antonio just mentioned, I'm going to be talking about incorporating co-management, refractive surgery co-management. I want to specify that. So for myself, I actually am an optometrist who works in a refractive surgery center right out of downtown Los Angeles. So I'm a little ways out, but I get to work hand in hand with my surgeons, and then I get to work with a lot of referring optometrists. So I'm really excited to hopefully show and make you guys more excited about, if you're thinking about adding refractive surgery co-management into your practice, how can you do that and what's going to make it successful? So the first thing that I wanted to touch on was looking at the state of affairs of the refractive surgery landscape. So especially with the COVID-19 pandemic, obviously things changed not only for everyone's day-to-day practice, but refractive surgery specialties also felt that as well. So something that was kind of surprising is that once the pandemic kind of started opening up again, there was an increase in refractive surgery rates, specifically in LASIK and PRKs. As you can imagine, a lot of our patients didn't want to wear their contacts anymore. They weren't going into work, they were working from home, so they started wearing their glasses, and then you had the whole issue with the mask and fogging up those glasses. So it actually increased refractive surgery rates last year when the pandemic started opening things up again. Population-wise, there's actually a huge population of patients who are suitable candidates for laser vision correction. Between the years of 2020 and 2021, there's over 150 million myopic patients and 50 million hyperopic patients who can potentially get refractive surgery. And that is a large bulk of our primary care patient population. LASIK, by no surprise, still the #1 procedure or the procedure of choice, about 80 to 85% of procedures. Another interesting trend that came up because of COVID-19 was that teleophthalmology consultations really went from almost minimal to no up to 80%, where patients are actually scheduling surgery just based off the telemedicine consultation. Don't worry, those patients still have a pre-op. We're doing all the appropriate scans and making sure if the patient is truly a LASIK patient or should they have PRK, ICL, things like that. Then lastly, as you can imagine, there's two main factors that kind of hold patients back from getting a refractive surgery consultation or coming in for a referral. And that delay is due to fear and affordability. The one thing that I do want to say on that is that those conversations around fear, not necessarily the affordability part, they're actually happening in the OMD's office. So these conversations are not happening when those patients are in our primary care exams, our annual exams, which is pretty surprising because 85% of the total comprehensive eye exams in a year are performed by optometrists. So there's kind of a miss in communication, or there's areas where we can really help educate our patients further. And there's a surprising statistic that I found out about in a lecture I was listening to a few months ago. And that's the fact that of those patients that are referred for refractive surgery, only 20% of those patients are referred by their ODs. So again, there's some disconnect where we're not talking to these patients. And instead, 80% of these patients, they're going on Google, they're going on Yelp. God forbid they go on Groupon and get a Groupon and get their eyes done. And you can kind of see, I did a screen grab from ODs on Facebook where this optometrist, she's kind of talking about that and the psychology of the patient, where they almost feel like, they're going behind our backs, or we're not going to be a cheerleader in their decision to move forward with surgery. And when you look at the numbers, we're really missing an opportunity to co-manage these patients and that comes to a loss of about $565 million in potential co-management opportunity. And that's just talking about LASIK alone. That's not even talking about cataract surgery, ICL patients, PRK. And so I do want to take a pause for either students or optometrists who are currently practicing. I want to ask, what is that hesitation? How come the conversation that we have about contacts of, oh, I see you're updating your glasses. Are we going to update your contacts? Are you interested in contacts? Are we also talking about refractive surgery? And, oh, are you interested in getting refractive surgery or talking more about it? So what's holding us back from having that open conversation? Is it because we're not as familiar with the technology that's out? Are we worried about postoperative complications? Or, a big fear when LASIK first came out was that, LASIK is really going to take away my patients. If I refer them, I might not ever get them back to my practice. And to be blunt, it's going to cut into, the revenues of the practice from annual exams and optical. So as we go through, just think about, why are we not just bringing up refractive surgery to our primary care eye exams? I did want to debunk the myth or kind of fear that, if you refer this patient out, it's really going to truly impact your practice. So if you look at the stats that are up here, so this is the method of vision correction in the entire United States, and only 0.2% of individuals are corrected through refractive surgery. That is less than 0.5% of individuals in the United States. If you take that and you apply that to the practice you're in, again, that's less than 0.5% of individuals are going to want to move forward with refractive surgery. So we're not really sending a ton of our patients out, and the patients who are getting refractive surgery currently, 80% of them we're losing anyway because we're not actively referring or having that conversation with them. One other thing that I found really interesting, so I actually went on Eyes on Eye Care and pulled the 2020 optometry report. If you're not familiar with it, it's a survey that's sent out annually to optometrists, practice owners, students to essentially get a pulse on the industry and where trends are with new grads. So there was two graphs that I thought were very interesting and applied very well to what we're talking about today. The first is what your clinical focus is. No surprise, 64% of optometrists have a primary care focus. That's what we are. It makes sense. We're primary eye care providers. And that being said, we're also managing 85% of those annual exams. I did want to look down at refractive surgery. Solid 1.4% of optometrists concentrate in refractive surgery. So I hope after having more exposure, listening to things, that we see that number go up a little bit more and more, since there's a lot of opportunity, especially on the patient education side. And then what really caught my eye in the 2020 report was the question, which modality of eye care or care do you plan to add or did you bring to your practice? And I thought it was really interesting. So I kind of rearranged the data a little bit. And if we look, you can see a third of the individuals who responded, a third of the optometrists wanted to add especially contact lens practice, which makes sense. There's a big push in myopia control right now. There's a lot of new data and information and lenses coming out. Ocular disease was number 2, which I'm super excited about. As we know, optometry is moving more and more medical based. 3 is pediatrics. I was a little surprised by that, but I see you, I respect you, I appreciate you. Whoever you are, please let me know. I will go ahead and refer all my pediatric patients to you. And then finally, vision therapy payment at number 4. And then if we look all the way down towards the bottom, you can see that only 4% of optometrists were thinking about adding a refractive surgery co-management model or a collaborative care model. So you guys are a little bit more of a tough crowd, and I kind of have my work cut out for me. So hopefully I can show why incorporating a collaborative care model is really important, not only to build your practice, build your career and clinic, but also to really help your patients. And to kind of put that into perspective, to me, there's only 2 things that were a little less interesting than refractive surgery that optometrists wanted to add to their practice. I'm not going to really count the cornea and contact lens. I loop that in with specialty contacts. And then dry eye, I don't know if I quite believe the 2.5%. A lot of my colleagues are still adding in a lot of dry eye clinics. So really, there's only 2 clinics where that were of less interest in refractive surgery, and that's nutraceuticals, so eye vitamins, and low vision. So let's look at why the first specialty clinic you should think about adding to your practice should be refractive surgery co-management. What I did is I went ahead and I pulled, if you were going to start fresh with a new clinic, what those relative costs would be, because you're going to do a tentative financial analysis. If we look at a dry eye clinic, that tends to be the most expensive, depending on how much equipment you want to invest in. So if you're getting all the top of the line, it's going to come out to around $150,000, but obviously you can start out with less. You don't need to start out, with all these advanced LipiFlow, MiBaFlow, all the scans. Myopia control clinic can range anywhere from 60 to 30,000. Again, it can be less. You at least need a topographer, fitting sets, and then you may potentially have A scans that you're doing for the axial length. So again, you're looking around 32,000. Vision therapy, bare minimum to get started is around 10,000 to 6,000 just for the equipment alone, and then also the licensing. And then my favorite, and what we're talking about, is going to be a co-management clinic and really working with different refractive surgeons. And there is zero to minimal cost to do this. And the best part is that all your patients are currently in your practice. They are potential refractive surgery candidates. We just need to work on making sure we're educating our patients and having that conversation around interest in refractive surgery. So that again, our patients aren't having to do all their own homework, going online, Googling, reading Yelp reviews, things like that. So let's say you're interested in incorporating a refractive surgery co-management model in your practice. How is that actually going to build your practice over time? So I wanted to run through a potential revenue model. And this is more so for, like, if you're thinking about premium cataract surgery. So think about things like PanOptix lens, Vivity, light adjusting IOLs. So really the new latest and greatest technology that's coming out. So the way that when you read down this graph, let's say you decide to, you're starting a brand new refractive surgery co-management model, you have a great collaborative care team that you're working with, and you're going to start by referring 3 patients per month. Say during that time, one of those patients go ahead and moves forward with the cataract surgery. The co-management fee per eye is around $500. Again, that's an arbitrary number. That's going to be very different depending on where you are. Your monthly revenue will come out to $1,000. You do that for the whole year. Your rough annual revenue or cash profit is $12,000. Now let's compare that to an annual eye exam revenue. So annual eye exam revenue, that's going to be the exam itself, optical sales, contact lens sales. The median eye exam value is roughly $350. So again, if these 12 theoretical patients, instead of getting cataract surgery, they just move forward with an annual eye exam and glasses, that's roughly going to come out to $4,000 per year. So you can see the difference. It's a 2.5 to 3.5 time difference if you're co-managing these patients versus just seeing them in practice and then continuing with glasses. So if you go down the rung below, say you get more comfortable and confident talking to your patients. You also have your patients who you let know, cataracts are starting to develop. I can't refract you down too much better with glasses. So now you're referring 5 patients per month. So you have a 60% conversion rate where 3 out of 5 patients are moving forward with surgery. Again, co-management fee per eye, $500. Now per month, you're netting $3,000 per year. That comes out to $36,000. When you look at the annual eye exam revenue, again, $36,000 versus the $12,000. So you can see how over time, the more comfortable you get and the more patients that you're having these conversations with, you can really grow your practice. And you're also going to be growing your skills in terms of the post-operative care. All right, so how do we really successfully incorporate a collaborative care or refractive surgery co-management model? And the first thing you might be thinking is, I'm in private practice, or I plan to be in corporate, or I'm already practicing in a corporate landscape. And both of those models I have seen very successfully incorporate a collaborative care model. Roughly 61% of optometrists practice in either private practice or a corporate setting. And so, for instance, in my practice that I currently work with, we have referring docs who are in all different types of model: private practice, lens crafters, Target Opticals, Costco. The only corporate setting that's been a little bit more difficult to co-manage has been America's Best, but otherwise, all these other models have worked fantastic. Another thing you might be thinking, practice owner versus associate doctor. So I want to kind of hit on the associate doctor side. If you're an associate doctor, co-management is just as important compared to if you're a practice owner. If you're an associate doctor and say you did a fellowship or a residency and you're really comfortable in managing these patients, you can bring a lot of value. I mean, we just ran through the revenue model, right? You can bring a lot of value to that practice if they are not currently co-managing refractive surgery patients, or maybe they do have a relationship set up, but they're sending referrals every once in a while. So as an associate doctor coming in, you can really build out those relationships as a strength. I know Dr. Ham earlier was talking about, if you have that skill set, bring it into your negotiations. And then on the practice owner side, practice owners really should be, looking at refractive surgery co-management as a KPI. It's part of your medical optometry, and it's a sect of that medical optometry. So how much of that practice revenue is coming from co-management versus optical sales, and breaking it down that way. So how do you start that relationship? If you're new to co-management, there's kind of one of three ways that you can go about starting that relationship with a refractive surgery center. The first is going to be talking to your colleagues. We all have doctors who work down the street, or you might be part of the same society. Talk to your colleagues and see how they're currently co-managing. Who are they co-managing with, and how is that relationship? In terms of, you might be going to a CE where you're directly talking to the surgeon who's putting on the CE, and you can let them know, I'm interested in starting to manage more of my patients. What are the next steps in terms of setting up a co-management relationship? And then lastly, depending on how large or small the practices that you're planning to refer to, they may actually have an external sales team where they're going to work with you directly to make sure that your patients are well taken care of. You get to establish that relationship. Anything that comes up will go through the sales team. And then same with an established relationship, if you already have that relationship there, make sure that you are analyzing kind of these different markers to make sure it still aligns with what you're looking for in referring your patients. So just like any relationship, there are three main pillars to success. And you can kind of apply these to any relationship. So really transparency, support, and then communication. And when we're talking about transparency, there's kind of 4 areas that I want to hit on. So the first is going to be establishing those expectations. As a co-managing doctor, you need to know, what are you expected to have completed for the pre-ops and post-ops? So for instance, a LASIK and a PRK patient, you're probably going to see the preoperative and postoperative management for this patient. But for cataract patients, implantable contact lens patients, refractive lens exchange patients, you're probably just going to be on the postoperative side. And then again, just addressing that fear, if you're concerned that if you refer that patient out, how is this partnership going to make sure those patients return back to your practice? Again, so for instance, at my location, we don't have an optical. So if there are any refractive needs in terms of glasses or contacts, we absolutely are referring back to our ODs. So say for instance, someone comes in, gets cataract surgery, they decide to do a monovision setup, but they work on the computer and they want a computer pair of glasses. If Mr. Smith is in my office for whatever reason, I'm going to let him know, I have to be very respectful of the relationship you have with your referring OD and our relationship with the referring OD, and I would like to send you back to them. 9 times out of 10, the patient has no problem. They absolutely understand. So again, just making sure that everybody's on the same page. Number 2, pay structure. Obviously, that's going to be very different. It's going to vary where you are in the US. It's going to vary between refractive surgery site. The one thing that I did want to hit on is to remember that there are anti-kickback laws and there are also anti-fee splitting laws. So if you are, for whatever reason, or if you are getting some type of payment for co-management, make sure that you are actively managing that patient. Otherwise, you can be in violation of those laws. So you can't just send the patient out, get a co-management fee and never see them back. You need to actively manage the patient. Number 3 is baseline knowledge. This is really important. And just making sure that your surgeons and your collaborative team know what you're comfortable with managing. Not everybody is going to be very comfortable managing, a corneal cross-linking patient afterwards. Not everybody is going to be comfortable managing an implantable contact lens if you haven't seen a lot of them. So just be very direct with whichever collaborative care team you're working with. And then finally, office visits. This is probably one of my favorites. We have anywhere from 1 to 4 doctors visit our clinic monthly to come shadow us, see post-ops, pre-ops, shadow surgery. And really what you should be looking for at these office visits is, if you're referring this patient, it's an extension of your practice. So you want to make sure that wherever you are referring, that again, it's a reflection on you. So you want to make sure that that patient care is living up to how you want your patients to be treated. So make sure that you visit the office. And again, if you have questions, ask while you're shadowing, or if you want to see a particular case, ask to see a particular case. Number 2, so support. Kind of like the screenshot I took of the ODs on Facebook, one of the top reasons optometrists were concerned about managing or co-managing patients was they weren't getting the support that they were looking for. So in terms of support, whoever you're looking to partner with, do they provide any type of training to expand your co-management services? So for instance, again, at our practice, we have a doctor who will schedule one-on-one training sessions to make sure anybody who wants to grow their co-management services, they can, so they feel comfortable managing ICLs or corneal cross-linking patients. There's also a lot of tools online. So do you have access to those resources to continue to build your practice? 2, educational support. A lot of times refractive surgery centers will put on symposiums with free continuing education. And that's really to make sure that you build your medical knowledge, you feel comfortable with the refractive surgeries that are offered. They could do a CE on the lenses they use and why. So making sure that your educational needs are supported. And then lastly, patient experience and feedback, which is really important. Sometimes you might have a patient who comes in and says, I didn't have the most positive interaction. If for whatever reason that's the case, do you feel comfortable reaching out to your collaborative care team? Can you reach out and see what kind of happened and what that conversation was to make sure, again, that everyone is on the same page? And then lastly, communication. Probably the most important in co-management, because again, we want everyone to be on the same page. And really, it starts with the referral recommendations. Co-managing ODs play a huge role in deciding what type of lens we're going to select for our patients. Again, if you have Mr. Jones, who's super particular, type A, he is probably not going to be the best PanOptix candidate because he's going to dislike the glare and halo. He's not going to like that his distance vision isn't as sharp as it was before. So you have a relationship with these patients. And if you know that about them, share it with your collaborative care team so that we know. It's just going to make patient management that much easier and seamless. And it's also going to increase your patient confidence because they know what you're recommending is being taken into consideration at the consultation. Access to surgeons and internal ODs. So this is a big one. I remember my first job right out of school, week number 2, I saw a 1-day cataract surgery post-op. And at the time I was thinking to myself, oh my gosh, this is the craziest eye I have ever seen. It was swollen, there was severe fuchs. This patient had really dense cataracts. He was 2200 prior to having surgery. And he came in LP. And I remember just thinking, okay, what do I do with this? And it was so easy for me to call the surgeon. I was able to get her on the phone within a matter of minutes. She let me know, you reassured the patient, you did everything right. You can see him at the 1 week. He's just really swollen because, again, a really dense cataract, fuchs, you're going to get a lot of corneal folds. But then she also told me, but I am happy to see the patient within the next day or two to make sure that he is reassured. So do you have that accessibility where you can call, text, get a response when you need it? Because when that happened for me, I felt much more comfortable. I knew my patient was going to be taken care of. And then I saw them back the following week. Vision was doing a lot better. They were a lot happier, especially touching base with the surgeon. And then now on the flip side, so now that I work at a refractive surgery practice, I'm the one doing the reassurance. So again, sometimes your patients, they just need a little extra TLC. They just need a little extra hand holding to let them know things are going to be okay. A lot of these patients have never gone through eye surgery before, so they don't know what to expect. So again, if they need to get back to their surgeon to get that reassurance, how easy is it to get those post-ops for them? So just, again, things to keep in mind and consider. And so really kind of putting it all together, there is such an opportunity, and it's such a space that I hope that new grads are going to start stepping into. Again, only 20% of patients are actually actively referred to refractive surgery centers. So I would love for new optometrists, new grads as a whole, to really step up and start educating our patients. That opportunity not only comes from practice growth, it comes from also growing your skills. And the person who's going to win the most out of this is your patients. So they're the ones that are benefiting the most. They're the ones that they're trusting you to refer them to a surgeon that you believe in. And then I really hope when the 2021 optometry report comes out, if we can maybe just even 5% of individuals respond that they're thinking about adding a collaborative care or co-management into their practice, I will take that. So I hope that, you know, everybody really look into adding collaborative care. It's so beneficial and it's so wonderful for your patients. So with that, Antonio, I'll turn it back over to you.
Thanks, Devon, really for sharing your tips and insight into co-management. That really was a fantastic presentation. And I couldn't help but think back personally, just personal experience. When I was practicing regularly, I found that when I actually started asking patients about refractive surgery, you know, have you ever thought about refractive surgery? Have you ever looked into refractive surgery? I really couldn't believe how many patients told me that they had actually been thinking about it and had been like researching it behind my back, so to speak, and never really talked to me about it because I never talked to them about it. And so they thought that like I didn't believe in it. And so like when I started asking more and more about it, I started finding, you know, these patients that were actually going and pursuing refractive surgery, and then I started co-managing, and I started doing it more and more and more and more. And then I started to find that there was a lot of new patients coming into the practice because they said, oh, I know this doctor, you know, co-manages refractive surgery. I'm interested in LASIK and et cetera, et cetera, et cetera. So it actually started to become a bigger and bigger and bigger part of the practice. And I was just getting tons of word of mouth referrals and had a lot of people coming in. And, you know, that led into other co-management, you know, collaborative care through cataract surgery, et cetera, et cetera. So I guess case in point, and, you know, you mentioned this really early on when you were speaking, is that just, you know, start talking about it more, talk to your patients more. But in any case, you know, thank you so much for your time. You know, we really appreciate your contributions to Eyes on Eye Care, really, you know, articles, everything you've done for us. So thank you so much. Yeah, and we hope to see you soon. And so thanks again. And for those that are still with us, we've got another bonus raffle code for this session. And that raffle code is My Eye Doctor. It's MYEYEDR. And up next, I'll be joined by my colleagues, Preeti Gohil and Rob Mediavilla, who are both on our recruiting team, and we'll be talking about job searching and taking your questions. So we'll see you then in about 5 minutes or so.